Hello guys, whether you are a seasoned expert in the aesthetic industry or someone curious about injectable treatments, welcome to my channel. Today I'm going to share with you about professional analysis and demonstration of medical aesthetic injections. I'm Alan, a dedicated aesthetic doctor specializing in injectable treatments. In the field of medical aesthetics, the details makes all the difference. From selecting the precise injection angles to expertly matching the right products, every step is crucial. In the upcoming demonstration, I will share my exclusive techniques and show you how to tailor personalized injection plans based on different facial structures and individual needs. I'm delighted to be here today to share my original injection method with everyone, which include the design process and injection details of Ellansé collagen mesh injection technique. There will be a practical demonstration later on. First, let's look at the underlying principles of this technique. As we all know, the relaxation and aging of our face are firmly due to the losing of the superficial muscular apparatus. We often refer it as mass. In the past, we commonly use fillers to perform an 8-point injection to solve facial impressions. That can easily lead to some issues of facial puffiness. However, most patients prefer to achieve a very natural anti-aging effect. They desire a firm lifting effect rather than a volumizing lifting effect. So, to achieve such results, the injection technique we will demonstrate today is particularly suitable. We call it Ellansé collagen mesh injection method. It provides a very firm tightening effect on our smooth layer. Therefore, this method can be used for injection, regardless of whether the relaxation is in the upper face or the middle face. Generally, for the upper face, I would choose 2 entry points at the forehead nodules. Perform a fan-shaped subcutaneous facial layer injection. Besides that, we need to find a point 1 cm above the queen point and again perform a fan-shaped injection that forms the upper facial or mesh tightening. This will result in a tightened and firmed forehead. It will provide a lifting effect for the eyes and the brow bone. This is the injection method for the upper forehead area. Next, we will focus on the lateral temporal area. I will mark the entry point at the zygomatic temporal junction. Cover from the entire temporal area to the hairline. Perform a fan-shaped injection. For those with obvious temporal hollowing who want a lifting effect at the outer corners of the eyes, in that case, we need to go back to the injection point 1 cm above the queen point. Then perform a fan-shaped injection from up to down. This creates a combined collagen mesh tightening effect involving the temporal region, hairline, and the queen point. Let's move to the middle face part. Previously, we would use zygomatic boy lifting treatment. This treatment often leads to a too wide middle face, which easily causes the problems such as the diamond-shaped face. So, I would choose the same entry point, which is the zygomatic temporal junction point. Perform a reverse tightening of the zygomatic ligament towards the preauricular area. This is the opposite direction compared to the traditional zygomatic boy lifting method. It will provide a firm tightening effect on the mid-face and the lower face. Apparently, we used to use a lot of fillers to flatten hollowness of the inner contour of mid-face. Most patients don't prefer this approach. Therefore, we could inject into the point between the zygoma and the temple, or more slightly inwards. Perform a fan-shaped injection in the mid-face area, covering the inner contour, upper cheek, and infraorbital area to achieve lifting and tightening of the middle face. For some ladies whose middle face sagging is quite severe, middle wrinkles and tear trough are already looking obviously. The solution is make the junction of inner contour ligament and the middle wrinkle as the injection point. Perform a fan-shaped bottom to top injection. This can help enhance the tightening of the entire middle face. Okay, there are lots of girls injected L8 points with facial lifting filler before. Although it provides some lifting effect to the lower face, it may cause the cheeks to look puffy and fat, or may cause uneven facial contour or chin displacement problems like this. Some girls, they like their face to have highlights and shadows, like a shadow below zygomatic boy and a highlight on jawline. This type of patient is also well suited for Ellansé mesh injection. Here is an easy way to do it. We mix this point as injection point. Make a fan-shaped mesh tightening. It will perform a very good lifting effect to entire lower face and jawline. Okay, next is the most common problem, nasolabial folds, and where our baby face is sucking. In fact, we only need to inject in where is chilling truth. It will soften nasolabial fold and rebound hollowing of the nasal face. Meanwhile, make lifting of baby face. It would make cumulative effects through less than miller wrinkles. Next, let's move to the lower face where jawline is. As we all know, this is a point on the mandibular ligament. Injecting in this point would help to flatten the marionette lines. This is what a lot of people mind, right? Let's perform a mesh injection here. Meanwhile, mark the same entry point. We know that the anterior masseter is a dangerous area. Instead, we will use this point to make an injection that could help in tightening the entire jawline. Many treatments method we used before, there is no way to do the injection here because many patients feel their face becomes wider after injections, some source of problems. So if we use the method I introduced today, it primarily targets tightening the smooth fascia rather than filling. Therefore, this injection point is particularly suitable for us to help tightening the entire jawline. When the entire jawline is quite loose, Botox injections also are not particularly effective. We can inject at the mandibular angle. It's tightening both jawline and the preauricular area. This is detailed explanation of the Ellansé collagen mesh injection method for the entire face. Of course, we could also use this method for someone whose neck is sagging, but please remember, a preoperative assessment is very necessary because we all know the tissue of the neck is very thin. If we over-injecting the Ellansé, it may form hard nodules to cause an uneven surface. Therefore, pre-detachment with tumescent fluid is the initial step. We know that the most important part of our neck is platysma bands. The sagging of the platysma muscle contributes to neck aging. Could also use the method we talked today. Would also result accidentally for neck. You could also mix with Botox to enhance the effect. Once you are very familiar with the application on the face, you can then extend the application to the neck and the chest area. That's all content of the aesthetic explanation part. Today we will focus on the aesthetic design and explanation. In the next session, I will share the hands-on injection process, giving you an immersive experience of how beauty is enhanced through injections. Don't forget to subscribe to our channel and turn on notifications so you won't miss any updates.